childhood onset lupus is defined as the onset of lupus prior to age 18. And as many people know, it's much more commonly diagnosed in adulthood, but lupus can be diagnosed during childhood. Approximately 15% of cases begin during childhood. So it's less common, but it does occur. And there are some differences between lupus when it affects children. As many people are aware, lupus is more commonly seen in female patients than in male patients, and the same is true during childhood, although the ratio is somewhat different, so that there are actually more boys affected during childhood with lupus than girls. So the ratio is more around 4-to-1 girls to boys than the 9-to-1 that you would see during adulthood. Similar to adult onset lupus, childhood lupus often does affect non-white populations. And in terms of the way the disease is diagnosed, it's exactly the same. So we use the same diagnostic criteria to diagnose lupus in childhood as are used for adult patients who present with lupus. But the manifestations can be somewhat different. We tend to see more severe disease in childhood lupus. It's much more common that organ disease would be present, such as the involvement of the kidney. Approximately 60% of children with lupus will have involvement of the kidney, so that they often skew towards a more severe spectrum of disease than what's seen in adults.